So welcome everybody to Prevention Works Live. There's quite a few people still joining, but I think we should get going so we don't run out of time. So welcome to our webinar and podcasts with Australia's leading changemakers in public health. So as you know, we're inviting people to come and speak to us about how they create systems change, and we're really looking forward to today. So I'd just like to begin today's session by acknowledging the traditional custodians of the lands from which we're all joining today. I'm joining from the traditional lands of the Tharawal people in northern Illawarra, and I pay my respects to elders past and present. I'd also like to acknowledge the traditional custodians of the various lands from which you all may be joining this event. And we also acknowledge all of the Aboriginal and Torres Strait Islander peoples joining today. So my name is Lucy Wright-Chetnik, and I'm the co-director of the Australian Prevention Partnership Centre. And as many of you know, it's a national partnership which includes researchers, policymakers and practitioners. And we're working together to look for innovative solutions to help prevent and address the growing burden of chronic disease. So we support research and its translation and communication to support evidence-informed decision-making. And we're also doing a lot to support the next generation of leaders in prevention, research, policy and practice. So this webinar, Prevention Works Live, is an opportunity to hear from, like I said, Australia's leading innovators and change makers. And it's really meant to be a window into some of the behind the scenes thinking, the challenges and the solutions that our speakers have identified and overcome over the years. So it's the sort of insights, hopefully, that you don't normally see in a scientific paper. And today's guest is Emeritus Professor Adrian Bauman from the University of Sydney and Natasha Strant. So I'm just going to give a brief introduction to our guests. So Adrian is one of our long-time and beloved colleagues, Emeritus Professor Adrian Bauman. He's Emeritus Professor of Public Health at the University of Sydney, where he has been for many decades at the forefront of international leading research on physical activity, obesity prevention, and he's also the director, or was the director of the Prevention Research Collaboration. He's also one of the founding investigators of the Prevention Centre and has been on the leadership executive ever since it was established in 2013, and co-directs the World Health Organization Collaborating Centre on Physical Activity, Nutrition and Obesity. Adrian is regularly listed on the Thomas Reuters most highly cited researchers. And last month at the Queen's birthday honours, he was officially given an Officer of the Order of Australia for distinguished service to public health, prevention of chronic disease and tertiary education. So congratulations and well deserved. But he's not only one of the most highly cited and respected academics, he's also incredibly respected and valued by policymakers for his collaboration and guidance and partnerships to ensure that the evidence he contributes is having an impact. And it's his insights and lessons on creating systems change that we're going to hear about today. I'm also delighted to welcome Dr. Natasha Strant. So Natasha is a senior manager with Wellbeing SA, a government agency that's funded through and attached to the South Australian Department of Health. It's a preventive health agency and it leads community-wide actions to support health and well-being of the South Australian population. And Wellbeing SA is one of the Prevention Centre's key policy and funding partners. So Natasha's going to bring some really valuable insights because she's worked both as a researcher and now working in health policy and programs. So it's a really rich and valuable perspective that you're bringing, Natasha, and thank you so much for joining us. Natasha completed her PhD in 2012 and co-founded then the National Active Healthy Kids Australia. She's worked a lot in advocacy and at the Health Foundation and joined the Wellbeing SA in 2020 and has recently been promoted to manager of early years, children and young people. So just to reiterate the format for today, so we've got about an hour. We'll hear for about 10 or 15 minutes from Adrian. Then for about 5 to 10 minutes, Natasha's going to give her response and her reflections. And then we're going to have a Q&A conversation. So that will include me asking questions of both Adrian and Natasha, Natasha and I both asking questions of Adrian. And there's also an opportunity for you as our audience to contribute questions to this. So you can go to the Slido and put in the participant code #systems change. And you'll either be able to add your own questions, or if you want, you can just vote on the questions that are already there, and the most popular ones go up to the top. So I'll hand over to you, Adrian, and we're really looking forward to hearing you speak. And then we'll go to Natasha for a response. Great, thank you.
Thank you very much, Lucy, and it's a pleasure to be talking about physical activity and systems approaches together. And it's a pleasure to be doing it without any slides, which is something that I really like to do. Why physical activity? Because it's an important risk factor for chronic disease and mental health and dementia prevention and falls prevention. And there's a WHO target to reduce inactivity by 15% by 2030. So it's an important part of the prevention landscape. But it's always been the Cinderella of risk factors, because it's not just something produced or solved by the health sector, more of that later. It's kind of owned by all kinds of people, by sport and recreation, by parks, by transport, by urban planning, by health, by primary care, by exercise scientists. So it lives everywhere, and no one therefore takes responsibility for it as a whole problem. One of our biggest issues in systems approach thinking is that our current funding models, NH and MRC, even the Heart Foundation and many of the NGO grants, Cancer Council, etc., MRFF, fund evidence generation, projects that build evidence that are looking at the efficacy of individual studies, individual interventions. How can we change physical activity behavior? Will this new app work? If we send you text messages, will it work? And then the next set of research is, if we send you text messages and give you an app, does that do better? And that research is replicative, it's incremental, and although it's good science, it's not building a population level research platform that's actually going to change the whole community's physical activity levels, which we desperately need to do. We've been fairly static for some decades. So what we need are approaches to research translation, and there's two ways of thinking about this. One way is we could take those evidence-based individual interventions and scale them up. So instead of 100 people in a controlled trial, we scale it up to 10,000 people if we can, to reach a lot more. And that's scaling up interventions. And that's an effective strategy to reach populations if you can do it, but it has its own challenges and is outside of the scope of today's talk. Today's talk's the other approach to translation, which is a systems approach. And a system is one of the ways we are now trying to characterize wicked problems that don't have single causes, that have a myriad causes and a myriad intersecting factors that contribute to them. Physical activity is one of those. I'll give you a physically active example as an analogy for a systems approach to something. Consider a bicycle. You could take the gearing off the bicycle and you've just got a metal ring. You haven't got anything except a metal ring. You could take the tire and you've just got a piece of rubber. You could take the handlebars and you've got a flat bit of metal. You put them all together in a bicycle and you've got something that just sits there. You get a person to drive that, and all of a sudden the system of pieces and parts within that entity start working to move something from point A to point B. So a systems approach says there are complex socio-ecological influences on everything, on obesity, on tobacco smoking, on diet, on immunization, on COVID risk, on everything that we're dealing with in our lives, and physical activity is very much in that space of wicked, complex problems. Is this new? It's new because the new generation of thinking is saying a systems approach we should think about. That's fresh. 35 years ago, we were doing this kind of thinking through the Ottawa Charter for Health Promotion. through concepts of healthy public policy and intersectoral action. And we were doing the same thing. We just called it something different. And it's nice to have it refreshed because it's bringing it back into the way of thinking about how we can make a population health difference. The Global Action Plan for Physical Activity of WHO has 4 themes: changing social norms, changing environments, giving people places to be active, and creating active systems. And we've written a book for the Prevention Centre on an active systems approach to physical activity, and I'll give you the reference for it. It's on their website at the end of this whole session. But how do you do systems work? What are the components? How do you start building a systems approach? First, you need to think multi-sectorally. It's not just outside of the health where the effector arms of making communities active exists. Secondly, you need networks and partnerships of all those agencies, public and private, government and non-government, working together to make the different parts of the system interact, to make the transport system talk to the park system, talk to the recreation system, talk to the sports system, to make primary care talk to the community facilities system, talk to the older adults, local swimming pool program. So you need the different parts of the system to talk together, and that's how it functionally works. You need to map a system, and we've mapped systems in many cities for physical activity, and contexts differ. Some cities don't have public transport systems. Some have climate issues that make different issues relevant. Some have good public sector sport facilities, potentially usable. Some places like Canada, we use schools after hours for community sports, particularly in the winter. Some people do dynamic models to actually model, well, if we made these evidence-based changes across the system and put them all together, we statistically model their interaction and see how much change we could produce in physical activity as a result. But true systems level interventions to change physical activity are rare or partial, and I'll describe what I mean by that in a minute. Either they're whole of government strategies, where all the agencies of government are collaborating and others in a kind of a physical activity task force that is sustained for a long time to make these changes, or at a whole community level, at one town or one large community, you're bringing all the partners together at that municipality level and getting them all to engage. And I'll give you examples of these in a minute. Systems research can also be in one of 2 general kinds of groups. Well, you can have the agent-based modeling and mapping, but that's precursors to systems research. Once you've actually got a system, you can do explanatory research to try and explain how that system is working. What's a piece of that system and how does it work? And realist evaluation is a method for doing that. I belong to a more pragmatic school of thinking where we're trying to map the whole system fairly briefly, but evaluate the most important components of it and work out, well, what are those bits doing, and not trying to work out every intersection and interaction that a realist evaluator would do in more detail. I'll give you a couple of examples of systems approaches. One would be 22 years ago in New South Wales, we had a Premier's task force on physical activity, and there have been excellent task forces, particularly in Western Australia and in New Zealand, that have lasted for a long time, where whole of government investment focuses on physical activity. And there's a cross-government mandate which government agencies have to subscribe to, and we had the Heart Foundation, we had Fitness Australia, Fitness New South Wales engaged, and they have to build an action plan with accountable pieces for each government agency to work towards building a system level intervention at that state or that jurisdictional level. And that's the macro level, and is difficult, but is amazing when it happens. The other kind is the whole community intervention. And I've done this half a dozen times for physical activity, but the best example was the Wheeling Walks program that we did in Wheeling, West Virginia 20 years ago. Targeting older adults, we got the mayor, the municipality, the urban planning environment people to build bikeways, the communications people to run a mass media campaign, the primary care doctors in the hospital come on board, and everyone to do these things together at the same time. And we actually mapped and showed that affiliation with the sense of coherence of this initiative was associated with more action. And these actions produce changes in the built environment, changes in the healthcare environment, in people receiving physical activity recommendations and having programs to go to, and changes in physical activity levels at the whole community level in the small city of Wheeling in West Virginia. So that these are examples of how we do systems work in the intervention area. To conclude, there are co-benefits of systems approaches beyond the individual level intervention like the new app or the health behaviour change program. The co-benefits are that systems approaches intersect with other things. They might intersect with reducing traffic if you've got a public transport component. They might intersect with mitigating climate change risks or improving air quality if you've actually got more people actively commuting, or healthier diet, or other components of other systems, because systems all interact with each other. But my final thought is this happens infrequently because it isn't easy. A systems approach is much more costly than an individual intervention. It's difficult because governments and other agencies still tend to live in silos, and bringing them together, you need an overall imprimatur where they'll all engage and engage for long enough. The timescale for systems approaches is not a 12-month project. It needs multiple years. And you need to make that collaboration happen such that it will be picked up and carried on by the organizations when you stop monitoring it. And that's a really difficult thing to happen. But 21 years later, the Wheeling, West Virginia Physical Activity Coalition still exists, still publishes a newsletter, and has redeveloped the entire foreshore along the Ohio River and is going really well. So it can happen, but it is a complex form of intervention. But we need these complex forms. We need this level of commitment, or our levels of physical activity will remain really quite static, and we won't meet the WHO targets by 2030.
Wonderful. Thank you, Adrian. That's a great conversation starter. So, Natasha, I'll go to you if you've got some reflections and a response, and then I'm sure people are already starting to think of many questions. So if you want to put your questions into Slido, and there'll be questions that Natasha and I will also pose. So Natasha, over to you.
Thank you very much. And Adrian, I always love listening to you talk. I just wanted to share a little story. I think one of the most impressive things I've seen about you is an email you dictated to me in response to something I sent you that was almost 2 pages long, that had so much, a wealth of information in a response to something. So it never ceases to amaze me, the wisdom and insight you can bring to a conversation. So thank you very much. Thank you, Lucy, also and the Prevention Centre for allowing me to be a part of this conversation. It's really a privilege, so thank you. My thoughts might go a bit all over the place, but you said so much, Adrian, that resonated, and I guess I am in a bit of a different situation to some in terms of, yes, I did start as a researcher. That's where I came from, and then I went to the Heart Foundation, so I've been a part of a non-government organisation, and now I am policy. And I guess before I was in my role now, I was the Physical Activity Officer for Wellbeing SA, and some would say I still am because there's no one else in that role at the moment, so it's still me. And I guess when I came to this role, it was a bit daunting, but also really great that there hadn't been anyone within the health portfolio that had really been focused or tasked with physical activity in South Australia for about 8 to 10 years. And so it had really been forgotten about. And so I was sort of brought in with a clean slate, which was really quite refreshing and quite nice. And, you know, so the first thing is, what are we going to do? This is a new priority. This is really, really important. We get some runs on the board and they're like, are we going to develop a physical activity strategy? And some of you may want to throw something at me through the screen, but I was very adamant and I said no. I was like, no, we do not, because there's already a framework in place at the international level that we could just take and run with and map our activities against. And so I think it is really important in this space, as you said, Adrian, is to really focus on what's been done before us and what we can build upon rather than create something new and shiny. And so it was very clear to me to use the World Health Organisation's GAPA as my framework for South Australia, and what we were already doing, which wasn't too much, but what we could do in that space. And as you said, Adrian, to cover over on which, I guess, GAPA does in some way, the Ottawa Charter, those different approaches we can take to create, you know, active, healthy societies. And so it was really key, I guess, because more and more I'm learning every day is that there's, especially for physical activity, there's not really a lot the health can do for physical activity. I'm learning more and more every day. We have the least amount of power across government to actually make some significant changes. We can put out as many social media campaigns, we can put some signs up, we can do all that stuff, but really we need the planning, we need the transport, we need the environment, we need all of them on board, because otherwise we're only really just a little drop in the ocean from the health. So I have had a very fast course in learning how to speak the language of many other sectors at a policy level. So I tend to know many of their strategies better than our own, to know what I can say to them to make sure that they're on board. And that's really important, I think, from a researcher and policymaker relationship, is how to keep across all of those things at once with there being so much information. A lot of us focus in on those health objectives, but really we need to put the health objectives aside, but know that they'll get there if we can meet these other objectives that align with other sectors and other areas, which is really important. And I guess what else I wanted to bring up was, you know, you talked about wicked problems, Adrian, and I guess we know that this shift in inactivity, and, you know, we're really, from a public health population perspective, we're wanting to get to those that are doing nothing or very little, really. They're the people we really want to get to for the biggest bang for buck. But that's a long game. That's a long-term game. I guess I'm still trying to grapple with myself. How do we create relationships between researchers, or not even the individuals, but just the notion or the institution of academic and research and policy, so that it can withstand staff changes, it can withstand, you know, government changes, it can withstand all of these sorts of things. Like, how do we establish those direct connections that have some accountability? Because, I mean, every government strategy that I have ever seen has evidence-based action in it. That's an enabler, it's a strategic direction, it's a principle that underpins everything. But when we're really talking about that evidence-based action, how do we make sure that we're creating mechanisms that make sure we're being accountable to that by having these ongoing, consistent relationships between research and policy? Because sometimes I think they can be very tokenistic, just to tick a box, and I just that's the thing I'm grappling with most. And I guess I'm a bit biased because I know how important it is to have those relationships, and so I've been able to reach out because I've known who to go to in the physical activity space. But for other policymakers, especially at the level I came in at, which is really where the grunt work is done, which is really where those relationships need to be bedded down, because they're the ones that then feed up. I think it could be daunting at that level to reach out to the right researchers in your area. So I guess it's just how we work out mechanisms to make that more concrete. That's probably my takeaways and my little reflections. Sorry if it was a bit jumbled, but...
No, that's perfect. Thanks, Natasha. Adrian, first I'll go to you, see if there's any reflections that you want to make in response to Natasha, and then a couple of questions as well.
Part of the skill of being an academic in this applied space is developing good relationships with your partners, with NGOs, with government agencies and government departments, and building those is an important part of encouraging the use of systems and then evaluating that approach as it works. And this is something the Prevention Centre is centrally engaged in across multiple issues. It's the interface between traditional academia and traditional policy, both of which are changing as we move together, and in the centre can have a conversation about this.
So, Adrian, I know like Natasha said, it's particularly challenging for people to do that when they're sort of more early mid-career researchers, but I know you've been sort of leading research policy partnerships for decades. So how did you start doing that? 20, 30 years ago, when you were starting to build, you didn't focus just on publishing papers and going to conferences. You've always built these strong relationships. So what did you do?
Firstly, I realized early on that you didn't only make a difference through the papers you published, something which many academics learn rather later than I did. And secondly, the people in the health department, and I want to single out one individual in particular, and that was Bill Bellew. In the 1990s, he ran the prevention part of New South Wales Ministry of Health, and he reached out to us and put together the task force and said we have to evaluate it. So it's the ministries of health, health departments reaching out and academics reaching back that start these partnerships. And this co-creation idea doesn't happen overnight. You can't just suddenly start trusting people, even if you're both really good, honest people. You've got to actually build that relationship over time, and it happens as a long-term partnership. And we in the Prevention Research Collaboration at Sydney University built a long-term partnership, particularly with New South Wales Health. And that was a very strong way in which this kind of work happens. It's more difficult where academics are transient and coming and going quickly, or where government agencies have a rapid turnover. It's much more difficult to embed this kind of thinking, which is that partnership. It's the evidence informing part of the system building part.
And certainly at the Prevention Centre, we've certainly recognised that those relationships have to start early, and we're building the Emerging Leaders Network, which is wonderful because it's starting to really involve early and mid-career policy people as well as early and mid-career researchers. And we're certainly going to be exploring new opportunities for facilitating and supporting those relationships through online networking and collaboration.
When I was younger, I'd take my PhD students or my immediate postdocs off to meet the Department of Health. And we'd have a meeting for an hour and they'd come out and say, I didn't understand a word of what went on in that meeting. And I said, no, it was a very good meeting. Come to a few more and you'll start to get the idea when you see what happens. And so it's that kind of almost apprentice system, because there's no method for training that kind of interaction. There's no textbook. There's no Masters of Public Health unit of study that you can do to learn that. And you've got to actually see how it happens and see when it's good and when it's not good based on kind of experiential. So that's how we did it in my little group.
Can I just butt in, Lucy, for lack of a better word? On that, Adrian, you strike me as someone that would be a very gracious and generous, I guess, leader in that space in terms of bringing PhDs and postdocs along. I'm just wondering, for those out there that might not be in similar situations but are wanting to still engage, I guess, from your experience and from what you've seen, how can you do that if you don't have someone above you that is willing to take you along for the ride?
That's very difficult to do from an early mid-career position, because you've got to be trusted by the department, who will give you a very formal response, but it's the informality part of the discussions with government people that actually make this thing work, this kind of approach work, irrespective of the area that you're dealing with. And so really, you need to be working in a place, and if your place is very much grounded in NH and MRC grants and not in research translation, then you need to be thinking about your next career move will be to a place where an academic environment which is more linked to government, and they exist in all states and territories in Australia. They exist everywhere.
So, Adrian, I want to just go to one of the examples that you mentioned in your talk, Wheeling Walks. Is that the right name? In this community, and it's an amazing story. You said it's still going 20 years later, and they've done some real transformational change to their local area to promote physical activity. So what were the factors that led to its success? What actually happened and how did you make that happen?
If you look at Kingdom's policy windows, the systems approach follows the same things. There are all kinds of policy intersects and things happening, and occasionally there's a confluence of ideas where a policy priority is a researcher priority at the same time. So that one, it doesn't have, you can't just go in and have a meeting and make it happen. It rarely happens that way. academics are around for a long time and things cycle, and the cycle time will come for these things. So that's the first situation. The second is you need receptor sites at each end that will bond. And in this case, it was a mid-level academic at the University of West Virginia in Morgantown and the mayor of Wheeling, who got together and had a cup of coffee and said, we've really got to do something, and we're committed. And then it was the sense of community that they built in their other agencies that made this work. There was a certain level to which the mayor could instruct the engineering department to build new walking paths, but nobody could instruct the hospital to actually change clinical practice in primary care or hospital care. So they had to work with the empathetic healthcare professionals in that environment. So it's one, it's opportunistic. Two, its time will come. Three, it needs champions on both sides. And four, it then needs the capacity and enthusiasm building across the system to make the system work better.
So you really have to understand the system that you're working with in order to create change. I mean, clearly you have to understand who the people are, who has influence, who's on side. Yeah.
And you can make some outstanding errors if you're not tuned in to the context of the system. For example, of the 8 best investments for physical activity, active travel is one of those that's recommended. When I've done work in the Middle East, particularly in the United Arab Emirates, active travel is just not on the agenda. People travel on freeways in cars. There is no public transport system, and everyone has their own vehicle that's going to move. So there's no active travel strategy, nor can there be. So the concept of having a comprehensive, we're going to cover all the bases, cannot happen there. There are climate issues there that mean you need to be active outdoors either at 6 a.m. or 7 p.m. and no time in between. So there's all kinds of context issues that you need to be familiar with before you can help a system to understand itself. And that's why we do systems mapping. When we did systems mapping in the north of England, in cities like Derby, we found quite different systems maps to what we found in Dorset in the south of England, because the contexts are still, even though it's the same country, still somewhat different. And that's why a systems map for your local city or your local area is a worthwhile enterprise.
Great. Natasha, we do have a few questions coming through, but I just want to ask one more of you. You mentioned one of your really insightful comments about the fact that in health, it's really quite limited what we can achieve from within health, unless we're working in partnership with other sectors. But I know many people have said that that's actually quite challenging to do. And you said you've been putting quite a bit of time and energy into that. So I wonder if you could reflect a bit about what's the right way of doing that and what's the wrong way of doing that, and how are you approaching this?
Yeah, and I think I was really lucky when I started at Wellbeing SA that, South Australia, our branch was very well known for its health in all policies approach, which was really led by Carmel Williams. Some really fantastic work around really respecting the other sectors and what their objectives are. Is really important, and I think not coming to the table with any assumptions and sort of coming to the table with any solution, really, rather coming with an open mind. So not drafting too much, not putting any proposals on the table, but really just having genuine conversations. Like Adrian has said, it's those informal conversations around really getting to understand what the other sectors need and want and what they're already working towards, and potentially how we can just maybe stretch or pull or just extend what they're already doing in a direction that might help the health agenda for physical activity. And I guess in South Australia, that's why one of the reasons why we landed on focusing on walking specifically as sort of our mode of activity, but also from an equity perspective, those sorts of things. But it was really important when we started talking about walking and what this walking would look like when we came to the other agencies. It was, well, what are you already doing that, whether directly or indirectly does impact how people and where and when people walk, and just talking them through that and then making them suddenly realise how much they're already doing in that space. Mm-hmm. So kind of lifting them up before you get in there and sort of ask them to help you out a little bit is really important, I think.
Yeah, and it's really looking for those common goals. If you're both trying to achieve the same thing, you're just calling it something different. There's real opportunities, isn't there?
Always having to do the really hard grunt work to be able to make sure you're across all those other ones, because really, you know, they kind of look at you sometimes like, we don't need you as much as you need us, and they get that, and we get that as well, which is why it's so important just to be across everything and really be ready to adapt and take on any opportunity that comes in front of you.
Adrian, anything you want to add about working across sectors? Any other thoughts?
Well, only that you need all the sectors to engage, but there has to be an achievable goal for them in their sector that's part of their KPIs. So for transport, if it's selling bus tickets and train tickets, then that's what you have to help them achieve, because achieving that will achieve your goal as well. If it's sport, it's getting more people participating in sport. You have to help them achieve their goals, not just look at everything through our health-centric physical activity lens, but look at it through the climate lens, the traffic lens, the education lens, whatever lens, the NGO lens, which means how can we highlight the emphasis of physical activity for Diabetes Australia or the National Heart Foundation or whoever we're working with, Transport Australia, etc.
That's great. Okay, so we've got a few questions coming through, and one that's got quite a few votes, so it's gone up to the top of the Slido list, which is how do you advocate and influence ministers for whole systems approach in physical activity, particularly in a political landscape that rarely prioritises preventive health? So have you got any experience or thoughts on that, both of you?
I've rarely influenced a... Oh, sorry, Tash, go.
No, you go first, Adrian. I'm keen to hear what you say.
I've rarely influenced a minister directly. In other words, had a one-on-one with a minister and they were influenced. You influence the minister through their advisors, and you influence their advisors through their advisors. So there are concentric rings that you need to get through. And if you get the minister's advisors to a particular mindset or a particular perspective, and their political advisors can see the strategic advantage of this as well as the state interest or the national interest, then you've got a chance of having a conversation with the minister that they will actually listen to, pay attention to, and might do something about. Without the support of those advisors, I've had very patchy success. It happens occasionally, but rarely, only with very keen and therefore somewhat outlier ministers, because they just happen to be keen on this topic.
And just to add to that, wholly agree with you, Adrian, wholly agree. And I think it's really important when you start to build those relationships and having influence, or not even influence, I believe it becomes that respectful two-way partnership as well, is helping that advisor, aka me, to have some options on the table if the opportunity arises, because sometimes we don't have enough time to come back to our respected colleagues in the research space to go, we need, you know, we've got this opportunity, we need to know yesterday. Like, it's really important, I think, to be very proactive rather than reactive when you're doing it this way, to really have that influence at the upper levels, because sometimes you need to make a decision on a dime. And if you don't have the information in front of you, you know, sometimes they're not the best decisions, or then they're never the absolute 100% gold standard decision. So I think it's really important to have that menu of options always on the table within that partnership too.
Carry around those options in your back pocket. They have to be feasible, affordable, and translatable, so they can't be too expensive and have to be able to be started to be implemented within a political cycle, and have them continuously and talk to your colleagues and links in the government departments, in the Heart Foundation similar. If they've got those ideas continuously, their time will come. It's that window of opportunity that I described before, and then you need to be around for a long time to actually see them happen, and that's different to other kinds of research.
And in that, I just wanted to add, I think it's really important, and you sort of touched on it with political cycles. I think we really need to make sure that, yes, this is a long-term game, but how can we show success in the short term for the minister, for the higher up executives, so that they can get some gold stars against their name within that 3-year lovely window.
So Adrian, you've got a reputation as the academic that policy makers, policy decision makers, ministers, advisors will go to for advice. So what is it that you do that makes you so approachable and for people wanting to reach out to you? And Natasha, I'm assuming Adrian is one of the people that you would get in touch with if you wanted advice around this topic. So what is it about the way he works? I'll go to you afterwards, that makes you likely to reach out to him. But first, Adrian, what is it that you do that makes yourself useful and valuable to people seeking advice?
I'll illustrate by two examples, but I won't mention the people involved. At one point, I was reached out to by New South Wales Health a little while ago, who asked me what was the last quit campaign for tobacco smoking, because we've actually abolished that branch and we can't find any evidence of what our campaign was, and you might have evaluated it for us. Can you help us? Unfortunately, I had that on my computer. And the second was an example. I was reached out to by someone who said, we desperately need to know something about childhood obesity this weekend for a meeting on Monday. So because I'm slightly crazy, I did a systematic review myself over the weekend and had the results to them by Sunday night, which they then implemented and which they never forgot and were grateful for a long time. So it's the capacity to be reactive, to be a corporate memory, and to be responsive in real time. And another time, we needed some information, and I needed the whole PRC team to do analysis, and I was driving down to Canberra in a meeting on my phone, hands-free, directing the analysis as we went. And by the time I got to Canberra, we had the analysis done and we had it to them that night. Those kinds of slightly crazy things means you can meet, because they operate in two time zones in government, either very slow or incredibly fast, glacial or the speed of light. And when it's the speed of light, if you can respond, they will appreciate that. And they do. And that helps cement the relationship more quickly.
Natasha, any other thoughts on that?
Agreed with all of that, Adrian, and you've exhibited that to me already. So just quietly, I have engaged Adrian specifically. We're developing a physical activity communications campaign for statewide across South Australia. So Adrian has been my go-to person for the last few months on that, which has been amazing. But I also just think Adrian, or being the type of person, the passion is infectious, and I think at the level that I'm at, that's really appreciated, because normally at the policy officer level, that infection for that one subject area is really there, and you really have that passion as well. So it's really nice to see that. And also I think it's because he just talks really frankly about what needs to be done to make a difference. And if you're going to do this, you're not really going to see any change. So, I think it's that frankness as well that is really being approachable, and you want to work with him because he clearly articulates. Every time he articulates, it's not necessarily, like you said, those traditional academic metrics. It's not about a paper. It's not about a conference presentation. It's actually about how can we help you as government make a difference. So that's really fantastic too.
Wonderful, thanks. So I'll go to another question coming in from the audience. So could you give us an example of an approach that hasn't worked for promoting physical activity, and what have we learned from that? I'll maybe start with Adrian, and then Natasha, if you want to add anything. There's something that hasn't quite worked, but I'm sure there are lessons in it.
Another example of a systems approach I was involved in was slightly more tied to obesity work, but physical activity was part of it. And one of the key government partners was not really committed, and they really were damning the project with faint praise or faint engagement. And no matter what we did, it just didn't happen. And after about 18 months, the whole of government process started to kind of wind down a little bit. And so these things, you need actual engagement and buy-in from all key partners. In a systems approach, you can't have four out of 5 and it's going to work. And that's one of the challenges in thinking about a system, and one of its difficulties. You need buy-in from everybody to make the system work, because the bicycle with handlebars and gears but no tires won't take its rider very far.
Oh, very true. I guess the only thing I'd add to that, there's no specific example that really comes to mind that's different to Adrian's, but I guess just something around that's really important, I think, about building capacity within from a policy government perspective. So, yes, I think it's good to outsource where the expertise is definitely out there, but I think using the research and what we know to build capacity within so we can in-house some of the work, I think could make the way things stick and the way things work a bit smoother and slightly less glacial. So that's probably my only other addition I'd make.
Okay, great, thanks. So another question, a COVID question. So how can we use the current pandemic as a leverage to promote physical activity despite the challenges? Can it pose also some opportunities for us? And have you already found that? Has it been demonstrated so far?
It's difficult because health department workforces are being holus bolus moved into the COVID, the contact tracing, the whole space to prevent COVID and increase immunizations and contact trace. So it makes prevention difficult at this point in time. The argument, though, that tobacco smoking, obesity and inactivity worsen the clinical severity and prognosis in people who develop COVID are strong. And so we need to think about prevention within a COVID context too. Those three risk factors are real for COVID and are well evidence-based. So we need to perhaps bring them out in a COVID space. The second opportunity in physical activity is you may have greater reach by having home-based physical activity and exercise programs, by moving a lot of stuff to online. And certainly initially there was great popularity for Zoom-based exercise programs. And that kind of thing is a way of thinking about, well, if we can't reach all our cardiac rehab patients with an exercise program, an online one's going to reach more of them than you would anyway, because the remote and rural ones and a whole range of people. So there are opportunities offered by some of the transitions that COVID is imposing upon us.
Natasha, any thoughts from you? I'm sure you've experienced colleagues being taken off to focus on COVID-related activities.
We were last year. It kind of threw a spanner in the works. But yeah, completely agree, Adrian. And I think that the biggest opportunity is reshaping the way we think about how we can support people to be physically active, and rather those online opportunities that might not have been looked at as something that's worth investing in from a policy government perspective, has definitely become something that we've been piloting and sort of working with different organisations that have been typically face-to-face, especially in those disadvantaged communities, to work out those that maybe don't have access to digital or online or website, like how we can help them if we do have to switch so fully again into that space too.
So there's a nice question here from the audience saying, who is someone that you really admire who's working in physical activity or in public health policy more broadly? If you could have a bit of a think about someone that you really admire and tell us a bit about why.
Of the pure academic ones, someone like Ross Brownson in the United States, at Washington University in St. Louis, brings policy research and linking to policymakers in the way that almost no one in the US does. And he's pioneered much of that work. And the other person I really admire is someone who's worked with me for a long time, both as a policymaker and now as an academic colleague, and that's Bill Bellew, because he's an example of someone who straddles the fence of having been a policymaker. Natasha's doing the same kind of thing the other way, but those kinds of people can think with both sides of their brain, policymaker and researcher at the same time, and are very good bridges to making things happen. And just while I've got Bill Bellew in the frame, we'll have a last slide at the end of this session with the reference to Getting Australia Active, which is the monograph we wrote for the Prevention Centre on systems approaches to physical activity. So stay online if you want to get that reference, but if you look up Getting Australia Active 3 in any browser, you'll find it in the Prevention Centre website. I just wanted to make, because Bill led that work last year, and I just wanted you all to have access to that, because it summarises much of what I've said, especially Chapter 2.
Great, thanks, Adrian. And thanks, Karen. She's just put the link up on the screen so you can see what it looks like. And I think Bill's with us on this call, so I can imagine he's going pink right now as he's listening. Natasha, what about you? Who do you really admire? Apart from Adrian, of course.
Of course. But this is probably more local, and so I don't want to name names, but there's someone that we had this local, a South Australian program called Opal quite a few years ago that was really quite successful until the funding got pulled. However, one of the Opal change makers in that program, he supervised me for placement during my PhD, and he also helped me with my, when I become Active Healthy Kids Australia, to sort of navigate, he moved to education to navigate the school space. And I guess it's just that person that just no matter where they go, they still have that drive, and they're still thinking of opportunities and ways of building physical activity and things into what they do and the who they do, and just lifting those underneath him up. I guess that's something that's been really really inspiring to me, and I really admire him.
Wonderful, thanks. So another question from the audience, it's about the evidence base, and do you have any examples where you've changed your mind about the evidence base because it's grown, or it suddenly pointed you in a completely different direction, and what happened as a result of that? So Adrian, you're laughing, so maybe I'll go to you first.
Hugely, I've got lots of examples. I can give lectures and lectures about this, but the most significant one, which actually polarized the field and people got quite annoyed with me, was I did a lot of the early epidemiological work on the risks of prolonged sitting and health outcomes. And then we started to refine it further and saw for those who were meeting physical activity guidelines, especially those doing a little bit more than guidelines, that seemed to offset many of the all of the epidemiological risk of prolonged sitting. And the people who saw sitting as an independent risk factor were not happy, but sitting's still a risk factor if you're physically inactive, but we should encourage physical activity also to offset the risks of sitting. So I did a U-turn on saying sitting's independent and changing my mind about that, and that has all kinds of policy implications. And the policymakers that said you've been telling us not to sit for a while also, when it takes to change the course of a ship takes a long time. And so this was a complex thing to navigate, and that's probably my biggest example of that.
Natasha, where were you? Were you at the research end or the policy end when that was happening?
Probably policy, and it's not that the evidence base has shifted, but I guess it's more the framing of how we frame physical activity to the public. You know, the Active Healthy Kids Days, you know, the report card focuses on kids meeting guidelines specifically. And I guess now that I'm in government policy, it's really, you know, we know that shouting the guidelines out to people and telling them they need to get to this much really is just a stick that they don't want to listen or hear about. So it's that kind of knowing that evidence is there. And ultimately, in a perfect world, that's where we'd be pushing everyone to. But really, you know, that evidence changing around just something, especially for those doing very little to nothing, you know. And I guess it's that shift in mindset and bringing people along for the ride that speak to guidelines, because a lot of the data we collect, especially at the government level, is based only on guidelines. So it's really hard to track those people if they're just shifting up a little bit. But we do know that there's benefit there. So yeah, that's been really tricky.
Sounds great. So this has been really a wonderful conversation. I've just noticed we've only got about 5 minutes left. So I just wanted to give you an opportunity, Natasha, if you had any other questions specifically that you wanted to ask Adrian. And also, Adrian, is there anything else that you specifically just wanted to end with, or just to sum up? In terms of what have you learned over the decades about creating change?
I might jump in with my question first, Adrian, if that's all right. It's a bit of a playful one. What is the worst advice you have ever received about working with government or policymakers?
There is still a prevalent, but used to be more prevalent, belief that it was impossible to work with government and with policymakers. And I still occasionally receive very strange looks for doing it, as if I'm doing something rather strange and unusual for an academic.
So the advice was don't do it.
Well, I'm glad you don't listen, Adrian.
Yes.
I don't.
So Adrian, any final thoughts or reflections that you'd like to share before we finish up?
We've been trying to get organised nationally around physical activity in Australia for a long time, both with measurement and surveillance and with the national physical activity plan, that we're one of the few countries that doesn't have a plan. We've got good researchers, but we really need to be better in this integrated strategic approach if we're going to make a difference.
Good tip. Natasha, any final thoughts or reflections from you?
No, I think Adrian just said it there. We need that cross-sector, and I just saw one of the comments around including clinicians as well, or practitioners, and you're right, we haven't really mentioned them, but I think it is that three-way street between policy, practice and research, and it's how we can get all of those across all the sectors. You know, we're definitely not there yet, but hopefully we can find some mechanisms to get us there a little bit quicker.
Wonderful. Look, it's been incredibly interesting and engaging, and thank you so much for joining. Thank you, Adrian, your experience and well, decades of experience really, and wisdom has been invaluable, certainly for those of us with the Prevention Centre, and I know for many other people as well. And thanks also, Natasha. It's been really lovely to have your perspective. It's really great that we have more and more people who've worked in both research and in government and in NGOs. So multi-talented and a very valuable three-dimensional perspective there. So thanks so much. That's great. And thanks to everyone for joining us today. It has been recorded, so some of you might be listening or watching the recording later. Also, just to let you know that the next Prevention Works Live masterclass will be on Thursday, the 19th of August, and we'll be having a conversation with Dr. Sandra DeMeo, who's the CEO of Vic Health. And if you want to learn any more about Adrian's work or the other work from the Prevention Centre, then I'd encourage people to come to our website and sign up for the Chronicle, which is our monthly newsletter. So thanks again. Thank you, Adrian. Thank you, Natasha. Thanks for the Coordinating Centre team for organising this and doing the IT behind the scenes. And we'll see you soon at the next one. I think we're finishing a couple of minutes early, so early mark. Have time to go and have a cup of tea. All right, thanks so much. Bye.